Our first speaker is going to be Cameron Kaplan of the University of Southern California Keck School of Medicine, presenting about disparities in outpatient care utilization, televisits, and health outcomes during the COVID-19 pandemic among patients with hypertension or diabetes. With that, I will turn things over to you, Cameron.
All right, am I sharing the correct screen now? You guys can see not the presenter view, but the slides.
Yep, looks
right?
good.
All right, good. Always have to check on these ones. All right, so our presentation is focused on looking at the impact of the COVID pandemic on utilization among people with hypertension and diabetes, and in general, kind of overall utilization as well, and also looking at we'll also have some outcomes related to cancer screening and things like that. So this presentation is, something that's similar to what I presented at the spring meeting, but has a little bit of an update, but focuses a little bit more on just the utilization piece. And as I present the aims, you'll see that there's a little bit more to some of the future plan studies as well. But just to sort of, here's an overview, some pictures of most of my co-investigators. And so the overall goals of this project are, one, to sort of understand the impact of the pandemic on racial and ethnic disparities in use of primary and preventive care. And the things that we're focused on particularly are receipt of routine preventive care and also cancer screening, chronic disease management for patients with diabetes or hypertension, and then looking at the short and medium term health outcomes that can be measured sort of with claims and administrative data. And one unique thing that we have is we have data from both commercially insured population. We have basically Optum health insurance claims that are national. And then we also have data from the LA County Department of Health Services, which is a large urban safety net system that has 4 hospitals and a large number of outpatient clinics. So we have sort of administrative data from that system as well. And so we want to sort of think about how this, commercially insured population fares compared to a safety net population as well during the pandemic. And then we have a qualitative piece where we're trying to understand, some of the decisions that were made and some of the impacts on patients and providers as well during the pandemic. So, just as sort of a background to this particular study or this particular set of results that I want to present, we kind of think that existing health disparities are, they're multifaceted, but one particular driver could be differences in access to primary care. And we know that the COVID pandemic created additional barriers to primary care, reduced social contact, there's mitigation policies, and then the shift to telemedicine. And so we wanted to sort of understand, did this pandemic worsen these existing barriers in access to care? So the data I'm going to be showing right now is from our Optum health insurance claims. For right now, I have a 1% sample. We actually have 100%, but we're running most of our analyses on the 1% sample just because it's a little bit simpler, and then we'll move it to the 100% sample once we get everything kind of fully figured out. But within our 1% sample, we're limiting it to adults with hypertension and diabetes. We have about 70,000 that fit in that have continuous coverage for at least 1 year. And then we want to just look at, like, among that population, what is the likelihood that they had an outpatient visit in a given month? And then also, what is the likelihood that that visit was in person, and sort of understanding how that changed over time. And then we're controlling for, race, ethnicity, income, sex, geographic region, and then seasonality effects. And so just sort of the overview of what this looks like is that on an average month, so in an average month, the likelihood that a patient with hypertension or diabetes had any visit at all is about 30 to 40%. So, I mean, and to kind of put that into context, that would be like on average, a patient with hypertension or diabetes is, has about 3 to 4 visits of any, these are evaluation and management visits with any physician during a year. So in a particular month, the probability is maybe about a third of the time they have a visit. And so this figure just sort of compares what things looked like in 2019 to 2020. In other versions of this, I have 2018 as well. 2018 looks a lot like 2019, but 2020, as we all know, is pretty different. And what you see is this sort of sharp decrease in just having any visit at all following the pandemic. So, people were actually not getting care at all. And that, drops, but it comes back, by the summer of 2020 already, we have like a larger, a sort of bounce back a little bit, but it doesn't really quite go back to what it looked like in 2019. So just recently we got the 2021 data, and I'll show you what that looks like on top of this. And you can see that in 2021, you also see this kind of slow return to, especially as the vaccines were kind of rolled out by March and things like that, you see sort of a return to what it looked like in 2019. It's one thing to kind of note is that, we could have expected that there would have been like a lot of pent-up demand or something like that, or that there would have been a lot of missed visits that needed catching up. We don't see like a kind of increase in the number of visits in 2021 over the previous years. But, it looks like it's kind of almost back to what it looked like in 2019. In terms of looking at how this compares, if you look at by race and ethnicity, and this is just this is not with the 2021 data, but this is just sort of looking at what the difference is between the kind of average number of visits in 2019 and 2018 versus 2020. You see about a 5 percentage point decline in the number of visits per month. And then if you look at that by race and ethnic groups, you can see that actually that difference is pretty similar across all racial and ethnic groups. This is, within our commercially insured population. The only one that was statistically significant is actually there's a slightly lower decline in the number of visits among Black patients. But it doesn't erase the disparities that already existed, but there's a slight, if anything, there's a slight shrinkage of the disparity between Black and white patients, but it's not large. So basically what we're seeing is that, this doesn't really suggest that, at least within this commercially insured population, that there are increasing disparities as a result of the pandemic in terms of number of visits. Within this population, and I don't have the figure here, but within this population, what we saw is a shift from about, basically 0% of visits were televisits before 2020. And that changes to about 15% of all visits were televisits. And there's slight disparities by race and ethnicity there too, with white patients much more likely to be seen in person compared to all other race and ethnic groups. Right now, I don't have the quantitative data from our safety net, but we do have some preliminary qualitative findings. We do have the data. We're just sort of working on making it so that we can share it within presentations right now. But the qualitative findings we can share are that, essentially what we saw in the safety net population within LA County, compared to the commercial population where we saw about 15% of visits were telemedicine. Within the safety net, we actually saw a really large decrease in the number of visits, but almost no telemedicine visits. And they did do some telephone visits, but no video visits. And so we asked the system leaders about this and sort of, understanding what the challenges of implementing telemedicine in this population were. And some of the things that came out in the qualitative interviews were that there were problems with patient engagement. So, there were concerns that some vulnerable groups, particularly immigrants and the elderly, had limited access to or comfort with televisits. Another kind of big, systematic barrier was that the platform that they used for their EHR didn't actually have the capacity for telemedicine visits until about a year into the pandemic. The other things that kind of came up were, a lot of the system leaders and providers told us that use of preventive services such as mammography, pap smears, vaccination all declined, and the system is still not caught up. And so there's sort of this shift, to kind of focus on the highest risk patients, but especially the kind of medium and lower risk patients are still kind of catching up. And this kind of was similar with the chronic disease management for hypertension and diabetes. A lot of patients didn't have labs drawn or blood pressure measured. So these are kind of things that we're focusing on and looking at with the quantitative data as well. Here's just sort of a representative quote, from a provider that said, we had never done televisits with that robustness, so we had to procure a tele platform and then deploy it, and that didn't deploy until last year. So this is an interview that we did, last month. So for the whole first year, there was no tele capacity. So, in kind of understanding this whole thing, we want to sort of understand how this safety net system performed compared to other types of health systems. So in conclusion, existing disparities in outpatient care among patients with hypertension and diabetes sort of remained throughout the pandemic, but we don't see evidence that they widened. There's a greater shift from in-person visits to televisits among racial and ethnic minorities, and also in low-income patients. And some of our future work is we want to look at the impact of the pandemic within the safety net population, again, kind of using this mixed methods study, sort of understanding some of these trends and understanding what in particular happened within the safety net population, given that there was like a low use of telemedicine, a large vulnerable population, many uninsured patients, immigrants, and another low-income population. And then we want to look at the impact of this reduced outpatient utilization that we saw during 2020, and look at that, the impact on health outcomes and health disparities, in particular focusing on preventable hospitalizations and things like that. And yeah, I'll acknowledge the collaborators. Some of them were on the first slide, and there's some other members of the team that weren't on the first slide, but that's a list of the collaborators. So I think I'm probably a bit under time, but thank you.